Good Apple is an Austin-based produce delivery service on a mission to end food insecurity in Travis County. And what we do is we partner with local farmers to rescue produce that would otherwise go unsold. We then operate a subscription-based produce delivery service for our paying customers. And then using those funds as well as partnerships with food pantries, we deliver fresh produce and other pantry staples directly to the door of families in need. Most of us are Dell Med students, so I think about 7 of us. We have a former University of Texas public health graduate as well as a couple of my colleagues from undergrad. But I think, what's really unique about our curriculum here at Dell is that we are provided time to work on these issues.
I'm the founding advisor at Good Apple, which is to say that I got to work side by side with the students, building it from idea to pilot to now scale of impact. There's this growing understanding in healthcare in general that the places we live, how safe the neighborhoods are, the kinds of homes we live in, the kinds of foods we have access to, whether or not we have transportation and insurance and healthcare matters to our health. Poverty makes people sick. And that's something that's ingrained in certainly the first few years of the curriculum at Dell Medical School. And then the medical school takes it a step further and gives third-year students the opportunity to pursue a second degree or spend time in the lab, or like the students did with me, spend a year building a civic impact company.
We kind of initially set out to address food insecurity for children. When we look at the research, we see that children actually tend to be food insecure even more than adults. So we had started that program working with pediatricians' offices in November, and then had been continuing it in the spring. It was going really well. And then COVID-19 hit. And, I think there just became a huge need around creating more food access for people who are elderly and the immunocompromised as well. We really feel like everyone deserves access to healthy food. And, as future physicians, we know how much that has an effect on health outcomes, especially during a pandemic where a simple trip to the grocery store can really increase your exposure to the virus.
We were definitely able to build a lot on the infrastructure that Good Apple already had set up in its one-for-one business model. In the spirit of accessibility and equitable distribution of resources, we wanted to make sure that this program was able to reach families who were in greatest need across the city, and again with a focus on people who are at highest risk of complications due to COVID-19. So we wanted it to be open access where someone could find it online on a resource board and sign up for a delivery, or they could get referred from a community group that they're a part of, or their normal food pantry could distribute the link to them as well. Or if they are on a televisit with their physician and mention that they are worried about leaving the house, they can also, the physician or someone in the physician's office could fill out the form on their behalf to get food delivered to them.
A few different local farms that we work here in town, Johnson's Backyard Garden being a huge partner in the program. And then through the food pantry, working with the Central Texas Food Bank. Really our job is to work on sourcing both fresh produce as well as other pantry staples. So things like grains and dairy and proteins to put in a single grocery delivery unit that we deliver to our impact clients. To date, we've provided over 17,600 deliveries, which is over 500,000 pounds of fresh produce and pantry staples directly to the doors of families.
I think especially as a medical student myself, our response to the pandemic I've been so inspired by all of the physician leaders that we, work alongside and who teach us every day at Dell Med. And so it was our way to contribute to our community's health and our patients' health, even though at the time we weren't able to necessarily be in the hospital with our colleagues the way we normally would be. This program gave us the opportunity to serve our community in other creative ways around the pandemic response.
I think what's particularly special about Good Apple is the community that's been built to make it happen. So we've got everything from students, faculty, and staff across the 40 acres to local farms, food pantries, food banks, private sector transportation companies, the city of Austin, who bought in around this single cause to make people healthier, to eliminate food insecurity and waste, to help folks navigate transportation barriers, and in more recent times, help them stay home and avoid risk of infection. So personally, to be a small part of that and to orchestrate all those various partners coming together gives me a lot of hope about healing, not just in our community, but across the country.